start. Okay. All right. Welcome to the Bonati Spine Institute. We have Dr. Bonati on the phone with a patient reviewing their MRI for the first time. Dr. Bonati, go ahead, take it away.
Okay, Johnny, can you see what I'm doing or not?
No.
You don't see the MRI?
No.
She's not live.
She's not
Oh,
watching
you're
online.
okay. All right. So you're gonna be blind in the things I'm gonna tell you. Sorry.
Okay.
All right. Let me ask you first. How old are you? Around 60?
No, 76.
All right. Your bones look very good and very healthy, but the canal that you have is abnormal and is creating several problems. You have a problem that is associated with the 3-4 lumbar vertebra, a problem on the 4-5 lumbar vertebra, and probably a problem on 5S1. You do have what we call a degenerative disc. This is a problem that happens to you through many years of discomfort. You are ignoring this discomfort because it's not a really bad discomfort, but you are ignoring this discomfort for probably around 20 years. This
Even longer than that. It started. I was a flight attendant for 34 years, and I think a lot of that has contributed to the problem.
Okay,
Along
probably.
with life.
Yeah,
So yeah, I've had it a long time.
Yeah. Well, the problem that I see here, I am going to discuss with you each level, and I am going to tell you which nerve is affected and how this nerve is creating a problem on you, okay?
Okay.
We have a collapse of the vertebra between 4 and 5. The disc is degenerated, and you do have some spinal stenosis in this area. The problem that happens, when that happens, is that you develop some pain on the back. There are different pains on the back created by the spinal stenosis. One usually is associated with a decrease of the canal, and the problem with that is that you have pain when you stand up and walk certain distance, your back starts to hurt. But because you also have a degenerative disc, this degeneration of the disc creates a different type of a back pain. This time, this pain is not only when you stand up or when you walk, it's when you are sitting or lying down. Do you have those two type pains?
I don't have pain when I'm sitting.
Okay.
When I lay down, if I'm laying down for a longer period, then I can have a little pain. But if it's not, like when I'm sleeping at night, I usually do fine. But maybe if I slept too long, which I normally don't, because I have a puppy that wakes me up early. But if I did, I think the longer it's like I get very tight around the hip area.
Okay. Now.
And the lower back.
All right. Now I'm going to tell you each nerve, how the nerves work here. But before I ask you that, I am going to ask you, are you losing your balance?
My balance has never, for a long time, has never been the best.
Okay.
So,
if I ask you to stand up and lift one leg, can you do that?
Yeah, I think so. I have been able to in the past, but let me see. Yeah, I think I can do that, yeah.
Can you do
it?
it?
Yes, I can do that.
All right. Each leg, you can do that?
Yeah, but I'm wobbly.
They're wobbly.
Yes, I can do it.
That's what I'm talking about, the wobbly. If in the morning you need to put your pants, usually you sit on the bed, am I right?
Yes, I sit down to do that now, yeah.
Okay. Now, the next thing that I see here is the fact that you have a major problem between 4 and 5. This behaves like this. It's pain on the back, and if you start to walk certain distance, the pain goes towards your hip. And if you keep walking, the pain from your hip runs outside of your thigh, cross your knee, goes outside of your calf, may grab your foot. Do you have that?
You know, it's funny. Just recently it started where the top part of my right foot on the left-hand side has felt like there's a nerve pinching somewhere in there.
Okay.
And I think it is coming from the back.
All right.
But you know, when you're talking about when I walk, once I get started walking, I seem to be okay. But
Okay.
it's like when I first stand up, I feel like I want to say frozen. Like I got to get like everything moving. Does that
All
make
right.
sense?
All right. Now let me review this nerve because I'm trying to work one nerve at a time, okay?
Oh God, okay.
You do have back pain, correct?
Yes,
Okay. You do have hip pain?
yes.
All right. You do have also some discomfort on the outside of your thigh from the hip towards the knee.
Not too much of that, no.
Okay.
Not
Do you
really.
have a discomfort from the knee outside of the leg?
I have had it in the past, but honestly, it has not been bothering me probably the last 6 months.
Okay.
It's kind of like, Dr. Bonati, the pain jumps around.
Okay.
Like it started out in my left hip, and I was telling Katrina down there that I went to chiropractor, I did acupuncture, I did physical therapy. You know, I tried all the natural things to do, and I went to a chiropractor that had what is it called? He had a machine that he could rotate on the affected area in the back of my hip, and it took away the pain on the left-hand side, but then it jumped to the right-hand side.
Okay.
And then now it seems to be on both sides.
All right. Well, that is the area that you have a collapse on the nerve. That is the fifth nerve root. And the fifth nerve root is also affected because it's twisted on the foramen. So it's pain on the back that goes to the hip, goes outside of the thigh in some cases, across the knee, outside of the calf, and grabs the foot. In the foot, usually the pain is on the bottom of the foot. Is that correct?
I don't have any pain on the bottom, no. I just have it on that left-hand side on the right foot.
On the top of the foot?
On the top of the foot, yeah.
Okay.
It started like 2 weeks ago, 3 weeks ago.
Okay.
Recently.
Yeah. Usually that nerve grabs the top and the bottom of the foot. It's more frequent than people, the bottom of the foot, because also the foot becomes numb. Is your foot numb?
No, but sometimes the bottoms of my feet hurt if I wear flip-flops for a long period of time.
Okay, all right.
So I kind of attribute it to the shoe, but maybe that's not what it is.
Yeah, all right. Probably what happens is when you have a flat, you change a little bit the mechanics of the motion of the spine, and the canals are not exiting the nerve normal, and they pinch the area, and that can create that symptoms that you have. So if I repeat this one, the pain is on the back, goes to the hip, sometimes goes outside of the thigh, sometimes goes outside of the calf, usually goes on the top of the foot, occasionally goes on the bottom of the foot. Is that correct?
What was the last part? Yes.
Okay.
Pretty much. But it's more.
Don't know, because if you talk to me about other nerve, I'm gonna confuse you.
Okay.
Now, let's talk another nerve now. Not only you have a fifth nerve root problem, also you have an S1 nerve root problem. This one is like this. Again, it's the same back pain. But what really happens is if you sit in a car for a long period of time and the seat is hard, usually you will have some butt pain. Is that correct?
Yes.
Oh.
Well, yeah, in the hip area. Well, the butt pain is where my pain is for them. So I don't really have it in the front part of the body. It's in the back.
I know. So I'm telling you again, the nerve is creating a problem that goes to the butt, correct?
Yes.
Okay. And then if you insist walking or something like that, and you have no choice but to need to walk, that pain not only goes to the hip, but also goes to the back of the leg, am I right?
Not too much to the back of the leg that I can think of. No,
When
I
you
don't
when
know
you
if I
say
get that-
when
I
you
get
say
that.
when you say not too much, that means yes. But if you say not too much, I prefer you say no and yes.
No, okay, I say no.
Okay, perfect. So
Like,
it's
I can't
only.
do stairs. I can't do stairs.
No, I didn't yet. I didn't go there yet.
Okay.
So
I'm sorry.
that's okay. Now now I'm trying to eliminate nerves. The fifth nerve root, we know what is going on with it. The S1 nerve root, now we know what is going on there. Now the other thing that you have is a problem when you go upstairs or you come downstairs. You cannot go upstairs very freely. You need to grab the handrail, am I right?
Yes, absolutely.
And then you don't trust in your knee. So when you come down, you grab the handrail and you go one step at a time, correct?
Yes.
All right. And if you walk distance, what fails easier? The knee or the leg?
More so in the back of the hip, like when you're talking about the back side.
The butt area. Okay. All right.
The butt area. We'll call it.
Okay. Now,
I didn't.
so
I'm sorry,
making you this easy, I need to tell you that you have a problem in between 3-4 affecting the fourth nerve root, the 4-5 affecting the fifth nerve root, and the S1 5S1 affecting the S1 nerve root. Those areas combine and making your life pretty miserable. You cannot walk more than maybe a block without stopping, am I right?
Well, yeah, that's probably true to stop. Yeah, I do the treadmill though every day.
Yeah, but the treadmill,
yeah,
the treadmill is a cop out. It's practically cheating, because the machine is working for you. You are not walking. The machine is walking.
Okay.
All right.
Yes, you're right.
Yeah. So if I say to you, try to walk. If I drop you in a car a mile from your house and I go home and I say, okay, I'll see you there, I promise you, you're not gonna come home. You're gonna take a taxi, because you're not gonna be able to get there. This back is in bad shape. Now let's see what we need to do. Thanks God, today we have techniques and technology that allows us to get you back. This problem can be resolved 100% after 3, probably 4 small procedures. 2 nerves are affecting the knee. 1 nerve is affecting the back, and another nerve is affecting the area of the butt. So if we correct this with our technology and our techniques that we develop at the Institute, you are going to have practically your mechanism to walk normal, totally back to you like you were walking when you were 40 years old. Now,
that would be great.
well, yeah, I understand, because right now you are limited, and despite that you sound very good, I think you limit yourself. You can do things, But if somebody said to you, let's go to the mall, you say, I'm going to go, but I am going to sit to have some coffee first.
Yeah, and that's not the type of person I am too. That's the problem.
Exactly. All right. Now, I am going to tell you, are you ready to fix this thing, or you just looking what's wrong?
No, I am ready to definitely fix it. Absolutely.
All right. So what I am going to do, I'm going to transfer you to one of my associates. And I am going to ask her to talk to you a little bit about when do you think you are ready to come over, and then when are we ready to see you. Between those two, they are going to give you some dates. Once you have those dates in your hand, you decide to move it or change it or something, you just tell us. But if you agree to that, nothing that we talk is written. So we need to examine you, we need to do some testing, we need to check everything, we need to be sure that you can tolerate the anesthesia and thongs. Although you remember, we use conscious sedation. So you are going to be awake, but you are not going to hurt. You are going to cooperate with me, and you are going to see the surgery. That is not only healthy from one side, that means you can help me, but also you can control me. If I go and I start to touch a nerve a little bit rough and you feel it, you just look at me and just say, hey, I'm hurting this, and the anesthesiologist will immediately take care of the problem, okay?
Okay.
Now, any questions?
Yes. Will you be doing the surgery?
If I talk to you on the phone, yes.
Okay. That's a positive.
Okay. What's the negative?
No negative. Well, nobody likes surgery. Let's face it. I mean, it's.
Well, you know, you know something.
Like you have to do it.
No, you're going to be very surprised. Nobody likes surgery, but you know what happened? You are going to do the first surgery is going to be to you, well, what's going to happen? But once you see that the surgery is not what is in your mind right now, and then you're going to see how fast you recover, and you're going to see immediately regaining some strength, you're going to be the one who's going to push me to do the whole thing. So when is the next one?
Yes.
All right.
Everything. So I like to get back. Well, what do you do with the root? I mean, the nerve. Do you destroy it or just move it?
No. We don't destroy anything. The problem with the nerve is this. Imagine that is a big tube that has, the big tube is the spinal cord, and then is exiting at each level a nerve. These nerves, they need to match coming from the bone of that is around that is holding the spinal cord, needs to go to another area that is the exit of the spine, and that is the foramen. If the foramen, the whole of the foramen doesn't match exactly with the area that the nerve is coming through, that opening there is not matching the foramen area, then you have a kink nerve, and that's one of your problems. And that kink nerve create all these problems. So what we will do is we will use a tiny little drills, just like the dentist, and we will open very much the foramen for the nerve. Once we open that, you immediately, your nerve is going to be effective 100%. It's like recovers immediately. Thanks God that happens, because then your possibilities to walk again are 100% return to you. So this is an incredible surgery with results that the people feel like it's a miracle. And it's really a miracle that we have today technology that allows us to do this, because great percentage of people are practically sitting at home without being able to walk because they don't have the knowledge that this exists. And the major problem with that is once you are sitting, the first thing that happens is your legs will swell up, you will have retaining fluid, you will develop some clots, you may have strokes, your heart is not being challenged every single day because you don't walk. And then these people in few years die. And die not because they really have a problem, it's because they have a mechanical situation that was not being taken care properly, and then the situation, then once we are 60, 70, 80, one little thing that doesn't work carry complications that they are fatal. So it's very important to correct those things earlier and instead to let the things sit there, because once you start to don't walk, you do have a problem. And once you start to go and think that, I can sit, no, every other organ suffers for the person who is sitting for too long without really moving. Well,
That's not good.
yeah, but you are blessed because what you have is something that we can correct totally, and once we do that, also the results are almost for life. We may need to readjust something in the future, but nothing that you are not going to go and say, oh, I'm as bad as before. No, You are going to go and you say, oh, well, I have a little discomfort here. And you're going to come back and say, do I need to do something or not? All right?
Okay.
All right.
Will you do, you said a couple procedures, will you do at the same time or in the same?
No, we will do it one a day. The procedure takes around maybe an hour. And then we do one. Then you go to, in the operating room, I'm going to test your muscles and your strength. And then in recovery room, all the pain associated with that specific nerve and the deficit on that specific nerve should be 100% gone. And some of the back pain will go away immediately. And
Okay.
then when we do the next other two, the total back pain will go away.
Oh, that would be great.
Yeah.
So you're saying that surgery should only be about an hour?
Yeah.
Okay.
Yeah.
I can handle an hour.
Yeah, and sometimes it's less than an hour. Depends at that time how good I am.
Well, I know you're good.
All right. I'll transfer you to Jamie, and she's going to talk to you a little bit, okay?
Sir, I look forward to meeting you in person.
Yeah, me too.
Okay, you take care.
Bye now.
Bye.
Okay, thank you, Dr. Bonati, for going over this patient's case over the phone with us. Thank you for taking the time. For those of you listening or watching, if you know somebody who is suffering from neck, back, sciatic pain, reach out to us at the Bonati Spine Institute. You'll see the number on the screen, or you can visit askbonati.com. Make sure you subscribe to this channel and hit the notification